Dr. Martino, I just got diagnosed with breast cancer, and they telling me many things. Help.
Well, the first thing I want you to know is that having breast cancer does not mean that this is the end of your life, first of all. Okay? Breast cancer is curable, and that is a true and complete statement. So if you remember nothing else from our conversation today, that is the most important thing that I want you to remember. Now, if we're clear on that, let's think about what we need to do next. Okay. At this point, because we know that it is cancer, the next decision that we need to make is, what are we going to do about it? How are we going to cure you? Okay? The first thing that we are going to have to do is we need a surgeon. And we need the surgeon because we need that person to decide what kind of surgery we need to do. Because your lump is small, we have two choices of what the surgeon can do. The surgeon can do a mastectomy, which is sort of the old way of doing things, or they can do a much less surgery. They can do a lumpectomy, which only removes a small part of the breast, leaving most of the breast in place so that it will still look beautiful and that you can still be proud of it. And once we have done that, then they will be able to add radiation to the breast area. And in doing it that way, you will have a very nice, very attractive breast that you will be able to wear your usual clothes. You'll be able to show your body off just like you always have been able to do before. So that really needs to be the next step, is doing the right surgery. So we need to get you to a surgeon. Once we have done that, then we will have all of the information from that surgery, and that information will come to us from the pathologist. The pathologist will tell us whether the tumor is small, what its actual size is. They will tell us whether the lymph nodes are involved or not. They will tell us whether the tumor has a hormonal quality to it, and whether the tumor is aggressive or not so aggressive, and also whether the tumor carries the HER2 new protein. And all of these things will be important to us in figuring out, can we stop with surgery, or do we have to do something more to give you a better chance that this tumor will never come back again? With that information, we then are going to figure out what kind of medicines can we use to give you a better chance of cure. And there are basically three types of drugs that we will need to think about. We're going to have to think about whether we need to use certain special hormones that are called anti-estrogens. Many breast cancers have a hormonal quality to them. That's actually a good thing. Those cancers are nicer, they're less aggressive. And if the tumor has that type of a quality, then we're going to want to use hormonal therapy against it. The second decision we're going to have to make is, do we have the kind of tumor where we need to use the drug Herceptin? Herceptin is an immune type of drug. If the tumor has that quality, then we will want to use Herceptin along with hormones. The final decision we're going to have to make is, do we also need to use chemotherapy? And chemotherapy is primarily used if the tumor is large, if the tumor has gone to the lymph nodes, and if the tumor carries a HER2 new protein. And so all of that will guide us as to, do we need to use chemotherapy, but also as to how much chemotherapy we need to use. Okay? The longest amount of chemotherapy that we might use would be about 6 months. Okay? The hormonal therapy is the longest of the therapies. That is usually used for about 5 years, and that's a pill that you would take once per day. If we need to use Herceptin, that will be done in a vein, and that'll be done for a full year every 3 weeks. But all of these decisions we are going to make once the surgery is done and once we have the details about the tumor, so that the treatment that we give you is very specific to what you need to have done. The purpose to all of this is very simply to cure you of this breast cancer. And again, I want you to remember what I said to you when I first looked at you. breast cancer is curable. Most women will be cured. And that's our purpose.